Hi, I'm Tammy Tucci, the Manager of Provider Outreach and Education with Palmetto GBA. Palmetto GBA is committed to helping providers navigate the pre-claim review process. This video will take you through an overview of the process, as well as the methods that a provider can submit a PCR request to Palmetto GBA. These are the topics that we're going to cover in today's video. Everything from an overview of the process to the individual decisions that one will receive when a PCR request is submitted. Let's begin with an overview of the process to better understand why we have the pre-claim review demonstration. Due to an overly high amount of fraud in the home health Medicare benefit, this demonstration was initiated. There was an increase in improper payment rates from 2013 to 2015 that was significant. The goal of the program is to reduce the improper payment rate while increasing the quality of care for Medicare beneficiaries in the benefit. This process is different than prior authorization because prior authorization occurs prior to the services being administered to the beneficiary. With pre-claim review, the services will begin to be administered. The provider will gather the documentation and then will submit it in for a pre-claim review decision before the final claim is submitted. The goal is to receive a provisionally affirmed decision so that the services can be paid. This gives us the opportunity to validate that the medical necessity requirements are met under the Medicare program. Who is involved in this process? Home health agencies, as well as Medicare beneficiaries who receive the home health benefit. And finally, the certifying or referring physicians who refer Medicare beneficiaries for home health care services. There are 5 states involved in this demonstration: Illinois, Florida, Texas, Michigan, and Massachusetts. While Illinois has already begun the process, the other states will receive at least a 30-day notification prior to their start date. Now let's talk about the services that are subject to the pre-claim review demonstration. These are the type of bills that are included in the pre-claim review demonstration. The final type of bill, as well as any adjustment claims, will be included. These are the HCPCS codes that are included. The PCR process applies to these HCPCS codes. Requests for anticipated payment or RAPs are not subject to the PCR process. Home health providers will continue to submit their RAP as they normally do and receive their partial payment. Keep in mind that while a RAP is not required to be submitted prior to submitting a PCR request, we think it's a good idea to do so. This allows the information for that beneficiary to be placed on the common working file, which will speed up the process of the decision on the PCR request. Remember that the request for anticipated payment cancellation process is not going to change. So any RAP that has been submitted that doesn't have the final claim submitted within 120 days of the start of the episode or 60 days after the episode pay date of the RAP will auto-cancel. The auto-cancellation process of the RAP will not change under PCR either. So if you do not submit the final claim within sufficient time, the RAP will still continue to auto-cancel. Home health services for less than 60 days will still be subject to the PCR review request. However, LUPAs are the exception. If you have 4 or fewer services for your beneficiary and it's going to be a LUPA, a PCR request will not be required. Providers under ZPIC review are not eligible to submit for pre-claim review. If you're unsure if you're under ZPIC review, when you submit your request, you will receive notification that you are and that you will just submit your claim normally. Providers are encouraged to continue to do requests for PCR until they receive a notification that they're no longer under review. Now let's talk about the number of home health benefits in a 60-day episode of care and how that works with the pre-claim review process. The PCR process applies to episodes of care for both initial and recertifications. If a provider has a beneficiary who is discharged and readmitted in the same 60-day episode and has a new start of care, a new PCR request will be required. Providers should also keep in mind that the PCR does not follow the beneficiary. So if a beneficiary is transferred to you who had a provisionally affirmed PCR request, you will still be required to submit for your own PCR request.
I'm Christy Foster, Senior Provider Relations Representative in Provider Outreach and Education at Palmetto GBA. Next in this video, we're going to be talking about submitting a home health PreClaim or PCR request. Remember that submitting a PCR request is considered voluntary. However, after the first 3 months of the demonstration in the state, if a home health agency is providing those services to a beneficiary, you need to be submitting a PreClaim review request. If you do not, then the claim will be subjected to prepayment medical review. If approved for payment, the claim will then be subject to a 25% reduction. Under the demonstration, a home health agency or beneficiary may submit a request for PreClaim review for applicable services. The request must contain certain elements to be considered for payment, including beneficiary information, certifying physician information, of course your home health agency information, the submitter information, in other words, who is submitting for your PreClaim review request, other information that we'll discuss in a little bit, and of course required documentation. There are several methods of submitting a PreClaim review request to Palmetto GBA. Some of those methods are faxing. As you can see on this slide, it gives you the Palmetto GBA fax number. If you decide to fax in your request to Palmetto GBA, be sure that all of the elements are on the fax request. This will ensure that you do not receive an incomplete. You can also mail in your request to Palmetto GBA. Please note on this slide, you have the address to send in your JM Home Health PreClaim review. Be sure the PO box, city and state is correct. You can also submit PreClaim review requests electronically. One of those methods is through the electronic submission of medical documentation, or ESMD. That information can be found at www.cms.gov/ESMD. Our preferred method is for you to submit your PCR request through the e-service portal with Palmetto GBA. That portal can be found at www.onlineproviderservices.com. You can go there for more information, and you can also find the e-service portal at www.palmettogba.com. The reason this is considered our preferred method of submission is because it will ensure that you do not receive an incomplete when you submit your documentation into Palmetto GBA. Remember that when you are submitting this information into us, you will be receiving your affirmation or non-affirmation based on how you submitted that PCR request to us. In other words, if you fax the request into us, be sure that the fax number is on your PCR request fax form. That way we will know exactly where to fax the affirmation or non-affirmation back to you. If you submitted your PCR through mail, you'll be receiving your non-affirmation or affirmation back through mail. And of course, the same way with your electronic submissions. There is certain required documentation that you need to submit when you're sending in for PCR. If you're going through our e-service portal, each of these tasks are outlined for you. Later in a video, we will discuss the e-service user guide, where a checklist can be found where you can go on at www.palmettogba.com, pull down the checklist, and be able to see what each of these tasks you'll need to include for your documentation. Task 1 will have such things as the actual face-to-face clinical encounter note. Again, that will be talked about further in detail on another video that's coming up. Task 2, you'll want to have the home health generated records that have been signed, dated, and incorporated into the certifying physician's medical records. Task 3, be sure to put in your plan of care, signed and dated by that certifying physician. And in Task 4, you'll have the signed and dated physician certification of patient eligibility. Task 5, you'll have the medical records that meet each home health requirement for confined to the home. In Criteria 1, you can see that it says, does the beneficiary, because of illness or injury, meet certain needs? Be sure that in your documentation that you are meeting that homebound criteria prior to submitting your PreClaim review request. Also in Task 5, the medical records that meet each home health requirement for confined to home need to be in there as well. Those are found in Criteria 2, both in Component 1 and Component 2. The checklist goes through both of those components, including the structural impairment, functional impairment, and activity limitations that you need to have included in your documentation. On this slide, you'll see what the actual Palmetto GBA e-service submittal request in the Palmetto GBA e-service portal looks like. Please note at the top, you will see a gray bar where you'll see PreClaim review. On that gray bar and where that task list is, if you do not see that, it simply means that it probably has not begun for your state. The PreClaim Review tab in the Palmetto GBA e-service portal will be available to you prior to your start date to submit PreClaim Review. This slide shows where you would go after you click on your PreClaim Review tab to actually pull up the PreClaim Review submittal request. As you can see on this slide, each of the boxes here are already filled in with the information that you provided when you signed up for the e-service portal. These tabs should automatically generate each time you go in to put in for a PreClaim review. One of the unique features of the Palmetto GBA e-service portal is the ability to go on and check beneficiary information. This information is pulled directly from the Common Working File. This ensures that you spell the beneficiary name correctly and submit the correct HIC number and date of birth. This next slide shows once you're submitting for your PreClaim review that you're able to put in additional information, including your HICS-PICS codes or your G codes. As you can see by the red X's, if you put something incorrect in the e-service portal, it will let you know right away. You'll answer several questions and you will upload different documentation to the task that we talked about earlier. You simply hit the Browse button, upload it from your computer, and hit Submit. Remember, if you're submitting in the e-service portal, you'll need to submit your documentation, and each time you submit something that is the same. So for instance, if you submit an entire set of documentation in task 1 with your plan of care and all your information, and you then need to move it also to task 2, you need to go ahead and rename the documentation differently for each task. This will ensure that it uploads correctly. If it's easier for your home health agency to upload everything in one PDF file, this is an enhancement that we have made to the e-service portal. You are now able to go on, submit that documentation or attach it on task 1, and then in task 2, if you need to refer to it, you can use the larger box and put refer to task 1 and the specific page that information can be found. In the e-service portal, you're also able to choose multiple components from drop-down boxes if it applies to your documentation. On this slide, you can see exactly what it looks like once you have loaded all of your documentation into the e-service portal. Notice on the right-hand side the orange boxes. If you had uploaded something incorrectly, don't worry, you can simply go to those boxes and choose Remove. If you notice on the left-hand side, the green checks just simply say that you have uploaded your information to the e-service portal. This is a great way to check and make sure all of your documentation has been loaded. One of our new features is also the Save feature. If you notice on the far left bottom, there's the button Save. This simply means that while you're doing your documentation, or if you're looking to submit additional documentation, you can start your PreClaim review and then save. When you need to go back on to add additional documentation or change information, you can then pull that PCR request back up and submit it to us. Again, one of the unique features of the e-service portal is it gives you the information that if you have errors when you've submitted your PreClaim review request. Neither mail or fax submission will give you this ability. Therefore, if you submit through one of those ways, you could be submitting incompletes and therefore would have to submit that information again. Once you've submitted your PreClaim review request into the e-service portal, you can then go check your messages and see if you've received your affirmation or non-affirmation. This message will give you your DCN as well as your unique tracking number or UTN. For providers who choose to submit their PreClaim review request through another method such as fax, ESMD, or mail, we have made available on the Palmetto GBA website a copy of the submittal request. This will ensure that you are able to submit your PCR request seamlessly. If you do choose to submit hard copy, we have separator pages that will help you when you're submitting your documentation. As stated earlier, for the initial submission of the PCR request, MACs are required to make the decision and notify each submitter within 10 business days, of course excluding federal holidays, of the receipt of the request. The submitter will be notified if the decision is considered incomplete, provisionally affirmed, or non-affirmed. The decision notification will contain that unique tracking number or UTN. And the notification will be submitted the same way that you submitted the PCR request to Palmetto GBA.
Now let's discuss some scenarios when pre-claim review would be required in reference to billing for denial for services, billing for other insurance, and Medicare secondary payer. If providers are billing for a statutorily excluded item with the GY modifier, PCR will not be required for those services. However, if a provider is billing with a GA modifier for services that have a waiver of liability on file, the pre-claim review request will be required for those. If providers wish to bill for a denial for other insurance, they would follow the normal PCR process for this. They would submit the PCR request, get their UTN on their decision, and submit it on the claim. If the claim was non-affirmed, the claim would process and deny. If the claim was provisionally affirmed, the claim would process and pay. Under the PCR demonstration, providers are still expected to submit claims for Medicare secondary payer when it applies. Providers can choose to do the pre-claim review or not, so we'll talk about both scenarios. For MSP claims, when you submit pre-claim review, you would submit the request to Palmetto GBA with the documentation at the same time that you submit the claim to the primary insurer. Once we make our decision, you would then be able to submit for Medicare secondary payer with the UTN. In cases when you have MSP and you do not seek pre-claim review, you would submit to the primary payer and they would make their determination. Then you would submit the claim to Medicare as you normally do, and it would ADR for documentation in which we would make our decision. Please keep in mind that if Medicare were to process and pay anything on this MSP claim, and it was after the first 3 months of the demonstration, the 25% penalty would apply. This is why we encourage providers with MSP claims to do pre-claim review. As Christy mentioned earlier, if you submit through the eServices portal, you will prevent yourself from submitting an incomplete request. Incomplete requests will be returned to providers if they're missing any of the required elements. Now let's talk about a provisional affirmation decision. A provisional affirmation is a preliminary finding that based off of the documentation submitted, this claim will meet the Medicare coding and billing requirements. Keep in mind this does not bulletproof your claim, and another Medicare contractor could come along and review it in the future. When a provisional affirmation decision is received, you will receive the HCPCS codes that were affirmed, as well as the UTN that will need to go on your final claim. A decision is not transferable. As we mentioned earlier, this does not follow the beneficiary. So if you have a beneficiary who is transferred to you with a provisional affirmation, you're still going to need to require one for yourself. PCR decisions are based off of the individual HCPCS codes on the request. So keep in mind that there is a possibility of receiving a partial provisionally affirmed decision, where some of the HCPCS codes included were provisionally affirmed and others were not. If you receive a partially affirmed decision, we encourage providers to resubmit for the non-affirmed codes. If for any reason a beneficiary's health changes after the PCR has been submitted and provisionally affirmed, and other services are ordered and provided to the beneficiary, those services should then be included on the claim. The provider will not be required to send in another PCR request. Now let's talk about non-affirmed decisions. If a non-affirmed decision is rendered, the provider will receive the HCPCS codes that were non-affirmed, along with a detailed description of the reasons why the non-affirmation was given. You will also be given educational information to refer to help better understand this decision. Resubmitting a home health pre-claim review request is encouraged by all providers who receive a non-affirmation. The process is the same as a regular PCR request. You would submit the PCR request with the documentation for consideration. You will select Resubmission on the submittal request, and we ask that you include the non-affirmation letter with that request. Keep in mind that for resubmissions, Palmetto GBA has 20 business days, excluding federal holidays, to make that decision. As always, with all decisions for PCR, not only will the provider receive a determination letter, so will the Medicare beneficiary. So we encourage all providers to have communication with beneficiaries about the PCR process and what steps you'll be taking with regard to resubmission. Now let's talk about final claim submission when pre-claim review was sought. Keep in mind that all of the normal information that's required on your home health claim has not changed. Also keep in mind that you need to have all of the information on the claim for the services that you were actually giving to the beneficiary. This means that if you ask for services or HCPCS codes in your pre-claim review request that you did not actually end up providing, those shouldn't be included on the claim. Also keep in mind that if the beneficiary's health changed after the pre-claim review was sought and you have added additional services and provided them to the beneficiary during this period of time, those also need to be included on the claim. The type of bill would remain the 329 type of bill. And the UTN would also need to be included on the claim. This is the only change in the components of what should be billed on your final claim under the PCR demonstration. Remember that claims are still subject to all the processing edits, so correct billing is still required. Once you put the UTN and submit the final claim, the claim will adjudicate based off of the decision on the UTN from the PCR request. So if you received a provisional affirmation, the claim will process and pay. If you received a non-affirmation, the claim will process and deny, and all of your normal appeal rights will apply. Now let's talk about final claim submission when pre-claim review was not sought. This would also be known as the prepayment review process. If a provider chooses not to submit for pre-claim review, they would submit the claim as they normally do, and the claim will suspend for additional development. The provider will then gather the documentation and respond within the 45 days that are required. The Medicare documentation, once received, will be reviewed and a decision will be made. Remember, if no pre-claim review was submitted and you instead chose to do prepayment medical review and the claim is determined to be payable, if it's after the first 3 months and the start date of your state, the 25% penalty would apply. Keep in mind that this 25% penalty is not appealable and it can't be passed on to the Medicare beneficiary. Let's talk about the path to appeal. The standard appeals process will apply in the pre-claim review demonstration. While you cannot appeal a pre-claim review decision, you can appeal a denied claim. If you would like to pursue the appeals process, simply append the UTN to your claim and submit it for adjudication. If it was non-affirmed, the claim will deny and all of the regular appeals rights will be available for your use. We do not encourage providers to take the path to appeal and instead to do the resubmission. Let's talk about the resources available to you for pre-claim review. The CMS website has various resources for pre-claim review that we encourage all providers to review prior to the start of the demonstration in their state. Palmetto GBA has a dedicated web page at www.palmettogba.com/PCR. We encourage all providers who are going to be involved in the PCR demonstration to bookmark this page for the latest information on pre-claim review. For providers who would like to check the status of their pre-claim review request, we have several tools that can assist you. The IVR status tool is available for providers who would like to call into the IVR and get their status. Keep in mind that the Provider Contact Center will not be available to give you status, and instead providers are encouraged to use the self-service tools. We also have a website status tool that's available for your use. Just go to www.palmettogba.com/PCR. Last, we would like to encourage providers that in order to stay up to date on the latest PCR information, please assure that you are a member of our listserv. These email updates will be sent to you each time new information is posted to the PCR website. This will also be the best way to be notified 30 days prior to the start of the PCR date in your state. We hope you found this information helpful on the pre-claim review demonstration for home health services. For more information on the specifics of the documentation requirements, please see our other PCR videos. Thank you and have a great day.